kidney failure, dialysis dependence, and even cardiovascular death. All of them can begin with something as ordinary as reaching into your medicine cabinet for relief from a headache or sore knee. Most people take the pill, feel better within an hour, and never give it a second thought. But what if that relief is costing you something you cannot see? What if every time you swallow that tablet, you are causing microscopic damage to the filtration system keeping you alive, damage that accumulates silently for years until the day your kidneys simply stop working? Here's what stops me in my tracks every time I think about it. Over 15 million Americans are currently living with chronic kidney disease, and in the overwhelming majority of cases, they have absolutely no idea their kidneys are failing until they have lost more than 60% of their kidney function. 60%. And yet, this is not a conversation happening in most pharmacies when you buy over-the-counter pain relief. It is not a conversation happening at most annual checkups. It is simply not being had. Stay with me through to the end because the number one kidney-destroying substance I'm going to reveal today is sitting in nearly every household in America right now, and it may be doing far more damage than simply masking your pain. We're talking about something with the potential to affect your heart, your brain, and your lifespan simultaneously. I'm Dr. Nathan Brooks, a physician with over 15 years of dedicated clinical experience focused on kidney health and the prevention of chronic kidney disease in adults over 50. In that time, I've sat across from countless men and women who came to me with something that sounded completely unrelated to their kidneys, only for us to uncover serious, progressive kidney damage that had been hiding behind years of seemingly harmless daily habits. Kidney damage is exactly that kind of condition. Deceptively silent on the surface, potentially catastrophic underneath. What I'm about to walk you through challenges something most of us have been quietly conditioned to accept. That over-the-counter medications are harmless because they don't require a prescription. That kidney disease only happens to people with diabetes or high blood pressure. That you would know if something was wrong with your kidneys. I want to be direct with you. That is not the complete truth. And after 15 years of watching patients progress to dialysis because this information never reached them in time, I'm not willing to stay quiet about it any longer. If this is useful to you, hit that like button right now. It helps this reach the people who genuinely need it. Let's talk about what is actually happening inside your body every single day and why your kidneys deserve far more attention than they typically receive. Your kidneys are two fist-sized organs positioned just below your ribcage on either side of your spine, and they are among the most sophisticated filtration systems in nature. Every single day, your kidneys filter approximately 200 liters of blood, removing waste products, excess fluid, and toxins while carefully preserving essential nutrients, proteins, and minerals your body needs. But this filtration does not happen in some large chamber. It happens in approximately 1 million microscopic filtering units in each kidney called nephrons. Each nephron contains a tiny cluster of blood vessels called a glomerulus that acts like a specialized sieve, and once those nephrons are damaged, they do not regenerate. You do not grow new ones. You lose them permanently. After the age of 40, you naturally lose nephrons at a rate of about 1% per year simply due to aging. That reduction alone creates real vulnerability. But it becomes genuinely dangerous when it combines with the 5 causes I'm about to reveal, because none of these causes simply stress your kidneys temporarily. Every single one of them destroys nephrons irreversibly. Here is what concerns me most as a clinician. Once you have lost 50% or more of your kidney function, your risk of cardiovascular death increases by 300%. Your kidneys and your heart are intimately connected. When your kidneys fail, your heart follows. That is not an exaggeration. That is documented medical reality. So, let's go through all 5, from the least recognized to the one that worries me most. And by the time we finish, you will know exactly what to watch for, what to say to your doctor, and what you can do differently starting tonight. Before we begin, I want to ask you something personal. Have you or someone close to you been diagnosed with kidney disease, or have you been told your kidney function is declining? Leave your answer in the comments below. I read every single one, and your answer helps someone else watching this realize they are not alone. Number 5 on our list is the most underestimated cause I see, and also the most dismissed, chronic mild dehydration. Before you move past this one thinking it's obvious or harmless, I need you to hear something important. Chronic mild dehydration is almost never about forgetting to drink water occasionally. In my clinical experience, it is nearly always a pattern of inadequate fluid intake sustained over months and years, and that distinction matters enormously. When you do not consume enough fluid throughout the day, your blood volume decreases slightly, and your blood becomes more concentrated. Your kidneys, which depend on adequate blood flow to filter effectively, are forced to work significantly harder to process the same amount of waste with less fluid available. Over time, this chronic strain causes the delicate filtering structures inside your nephrons to become scarred and damaged. The result is a gradual, silent decline in kidney function that shows up on blood work years later as chronic kidney disease. But here is the part that concerns me far beyond the hydration itself. Chronic dehydration in adults over 50 is frequently driven not by lack of access to water, but by intentional fluid restriction to avoid frequent urination, especially at night. And I understand that impulse completely. Nobody wants to wake up 3 times a night to use the bathroom. But research shows that adults over 60 who restrict afternoon and evening fluids to avoid nighttime urination have a 47% higher rate of declining kidney function over a 10-year period compared to those who maintain consistent hydration throughout the day. 47%. That is not a small difference. The solution is not drinking more water at night. It is front-loading hydration earlier in the day. Aim for 6 to 8 ounces of water with every meal and every mid-morning and mid-afternoon snack. By 4 p.m., you should have consumed 70 to 80% of your total daily fluid intake. And here's a small but effective pro tip. If your urine is darker than pale straw color by mid-afternoon, you are already dehydrated regardless of whether you feel thirsty. After 50, the thirst mechanism becomes less reliable. You cannot depend on thirst to tell you when to drink. You have to drink intentionally, on a schedule. Number 4 is the mistake I see most consistently, and it is one that feels completely logical until you understand why it does not work the way most people think. Excessive dietary sodium. Most people know that too much salt raises blood pressure. What they do not know is that high blood pressure is the second leading cause of kidney failure in the United States, responsible for nearly 25% of all cases of end-stage renal disease requiring dialysis. Here is the mechanism. When you consume excessive sodium, your body retains water to dilute that sodium and maintain the correct concentration in your bloodstream. That extra fluid increases your blood volume, which increases the pressure inside your blood vessels, including the tiny, delicate blood vessels inside your glomeruli, the filtering units of your kidneys. Over months and years, that sustained high pressure damages the walls of those blood vessels. They become scarred, stiff, and eventually stop filtering altogether. The nephron dies, and remember, you do not grow new ones. What makes this particularly insidious is that the sodium most people consume does not come from the salt shaker on the table. Research found that over 70% of dietary sodium in the average American diet comes from processed and restaurant foods, foods that do not even taste particularly salty. Bread, deli meats, canned soups, frozen dinners, restaurant meals, condiments, and cheese. A single serving of canned soup can contain 800 to 200 milligrams of sodium. The recommended daily limit for adults over 50, especially those with high blood pressure or kidney concerns, is 1,500 milligrams total for the entire day. One bowl of soup can exceed half to 3/4 of your entire daily safe limit. After the age of 50, this becomes harder to manage naturally because kidney function gradually declines and your kidneys become less efficient at excreting excess sodium. You can consume the same amount of sodium you ate at 40 and experience significantly higher blood pressure and kidney strain at 65 simply because your kidneys are not clearing it as effectively. The solution is not eliminating salt entirely. It is becoming aware of hidden sources. Start reading nutrition labels. If a single serving contains more than 300 milligrams of sodium, consider it a high-sodium food and consume it sparingly. And here's a practical pro tip. Fresh herbs, lemon juice, garlic, and vinegar can add enormous flavor to food without any sodium. Your taste buds adapt within 2 to 3 weeks. What tastes bland today will taste perfectly seasoned in less than a month once your palate recalibrates. Tell me in the comments right now, were you aware that most of your sodium intake comes from processed foods rather than the salt shaker? I want to know because many people watching this are learning this for the first time, and your comment helps me understand how many people need this information. Number 3 is one that catches almost everyone off guard because we rarely think about something as healthy as protein as a potential cause of kidney damage. Excessive protein intake, especially in people with existing kidney vulnerability. Your kidneys are not passive filters. They are metabolically active organs that must process and eliminate the waste products generated when your body breaks down protein. The primary waste product from protein metabolism is called urea, and your kidneys are responsible for filtering urea out of your bloodstream and excreting it in your urine. When you consume more protein than your body needs, especially animal protein, your kidneys are forced to work significantly harder to process and excrete the excess nitrogen waste. For someone with healthy, fully functional kidneys, moderate increases in protein intake are generally well tolerated. But here's what concerns me. If you already have early kidney disease, even if you do not know it yet, or if you are over 60 and have naturally lost 20 to 30% of your nephrons simply due to aging, a high-protein diet can accelerate kidney function decline dramatically. Research found that adults over 60 with early-stage chronic kidney disease who consumed more than 1.2 grams of protein per kilogram of body weight per day showed a 54% faster rate of kidney function decline over 5 years compared to those who consumed 0.8 to 1.0 grams per kilogram. 54% faster decline. That is the difference between maintaining kidney function into your 80s and requiring dialysis in your early 70s. This is critically important for adults who follow high-protein diets for weight loss or muscle building without ever having their kidney function checked. If you are consuming protein shakes, eating meat at every meal, and supplementing with protein powder, and you have not had a comprehensive metabolic panel with creatinine and eGFR measured in the past year, you are operating blind. For most adults over 60 without kidney disease, 0.8 to 1.0 grams of protein per kilogram of body weight per day is appropriate. For someone who weighs 70 kilograms, about 154 pounds, that is roughly 56 to 70 grams of protein daily, which is far less than most high-protein diets recommend. And one practical pro tip. Plant-based proteins, beans, lentils, tofu, generate less nitrogen waste and create less strain on the kidneys than animal proteins. If you have any kidney concerns or a family history of kidney disease, shifting even 30 to 40% of your protein intake to plant sources can make a genuine protective difference. Number 2 is the combination I take most seriously in my practice, and if this one applies to you, I want you to hear it clearly, not with fear, but with the understanding that knowing early is everything. Proton pump inhibitors, or PPIs. PPIs are among the most commonly prescribed and over-the-counter purchase medications in the world. Brand names include omeprazole, esomeprazole, lansoprazole, and pantoprazole. They are used to treat acid reflux, heartburn, and stomach ulcers by dramatically reducing stomach acid production. And for short-term use, 2 to 4 weeks, they are generally safe and effective. But here is what most people are never told. Long-term use of PPIs, defined as daily use for more than 3 months, has been linked in multiple large studies to a significantly increased risk of chronic kidney disease and acute kidney injury. Research published in JAMA Internal Medicine followed over 10,000 adults for 5 years and found that those who used PPIs daily had a 20 to 50% increased risk of developing chronic kidney disease compared to those who did not use PPIs. And the risk increased with duration of use. The longer you take them, the higher your risk. The mechanism is not entirely understood, but it appears that PPIs cause a type of inflammation in the small blood vessels and tubules of the kidney called acute interstitial nephritis. Over time, this chronic low-grade inflammation scars the kidney tissue and reduces filtration capacity. What makes this so important is that millions of people are taking PPIs daily for years, sometimes decades, for symptoms that could often be managed with dietary changes, weight loss, elevation of the head of the bed, and timing of meals. They were never told there was a kidney risk. They were never told to try stopping after a few weeks. I think of a patient of mine, a retired woman in her late 60s, sharp and health-conscious, who came in for a routine checkup. Her creatinine level, a marker of kidney function, had risen significantly since her last visit 2 years prior. I asked about new medications. She said nothing had changed. Then I asked about over-the-counter medications. Oh, I take omeprazole every morning. I have for probably 8 years. My stomach doctor put me on it and I just kept refilling it. No one had ever suggested she try stopping. No one had ever checked her kidney function while she was on it. We worked with her gastroenterologist to taper the PPI and address her reflux with lifestyle changes. Within 6 months, her kidney function had stabilized, and within a year, it had improved slightly. She told me at her follow-up, "I had no idea something I bought at the pharmacy without a prescription could damage my kidneys." That is what catching something early looks like. It's not a crisis. It's an opportunity. If you are taking a PPI daily and have been for more than 3 months, please schedule an appointment with your doctor to discuss whether you still need it, whether there are alternatives, and whether your kidney function should be monitored. If this information is opening up new possibilities for understanding your kidney health, I want you to hit the like button right now. It genuinely helps me reach more people who need this information. And if you are not yet subscribed, please subscribe now and hit the notification bell so you never miss these critical health conversations. Number 1 is the cause I encounter most frequently in my practice, and it is the one that is most consistently overlooked, most poorly communicated, and in my opinion, most deserving of a direct, honest conversation: non-steroidal anti-inflammatory drugs, or NSAIDs. Over 30 billion doses of NSAIDs are consumed every year in the United States alone. 30 billion. The most common include ibuprofen, naproxen, aspirin, and dozens of brand-name formulations available without a prescription at every pharmacy, grocery store, and gas station in the country. For adults over 60 who take an average of 5 or more medications daily and who frequently experience joint pain, headaches, and muscle aches, NSAIDs become a nearly automatic reach. A sore knee, take ibuprofen. A headache, take ibuprofen. A backache, take naproxen. Day after day, week after week, year after year. And the cumulative impact on kidney function can be catastrophic. Here is the mechanism. NSAIDs work by blocking an enzyme called cyclooxygenase, or COX, which is involved in inflammation and pain. But COX enzymes also play a critical role in regulating blood flow to the kidneys. When you block COX, you reduce blood flow to the kidneys. Less blood flow means less filtration. Less filtration means waste products accumulate. In the short term, for a few days, your kidneys can compensate. But when NSAIDs are taken regularly, especially in adults over 60 whose kidney function is already declining naturally, the sustained reduction in blood flow causes ischemic damage. The nephrons are starved of oxygen and nutrients. They become scarred and die. Research published in the New England Journal of Medicine found that regular use of NSAIDs, defined as at least 3 times per week for more than 1 month, increased the risk of developing chronic kidney disease by 35%. And in people who already had mild kidney impairment, regular NSAID use increased the risk of progression to kidney failure by over 80%. 80%! What makes this genuinely dangerous is a concept called cumulative nephrotoxicity, the progressive, irreversible kidney damage caused by repeated exposure to kidney-toxic substances over time. The ibuprofen you took yesterday is not the problem. The ibuprofen you have taken 3 times a week for the past 5 years is the problem. The visible symptom, pain relief, is not the end point. It is masking the invisible damage happening much deeper. I think of a patient, a retired man in his mid-70s, active and determined to stay independent, who described taking ibuprofen nearly every day for joint pain for over a decade. He assumed it was safe because it was over the counter. He had been on the same medication regimen for years. No single prescribing doctor had ever asked about his over-the-counter medication use. A routine blood test revealed his kidney function had declined to less than 40% of normal. He was in stage 3B chronic kidney disease, one stage away from needing preparation for dialysis. We immediately stopped the NSAIDs and worked with a pain management specialist to address his joint pain with physical therapy, topical anti-inflammatory creams, and occasional acetaminophen, which does not damage the kidneys. Within 3 months, his kidney function stabilized. Within 6 months, he told me, "I feel better overall, and knowing I'm not damaging my kidneys anymore gives me hope I didn't have before." That was not coincidence. That was informed intervention. Here is your action plan starting tonight. Stop any regular use of ibuprofen, naproxen, or other NSAIDs unless specifically prescribed by your doctor for a diagnosed condition with regular monitoring. Acetaminophen at 500 to 1,000 milligrams is a safer alternative for most types of pain and does not damage the kidneys when used at recommended doses. If you use NSAIDs for chronic pain, schedule an appointment with your doctor this week to discuss alternatives. Write down every medication you take, prescription, over-the-counter, and supplements, and bring that list to your doctor. Ask directly, "Do any of these medications affect my kidneys, and should I have my kidney function tested?" Request a comprehensive metabolic panel that includes creatinine and estimated glomerular filtration rate, or eGFR. This simple blood test tells you exactly how well your kidneys are filtering. If your eGFR is below 60, you have chronic kidney disease and you need a kidney protective care plan immediately. Drink water intentionally throughout the day. Front-load hydration before 4 p.m. Read nutrition labels and choose foods with less than 300 milligrams of sodium per serving. Limit animal protein to 1 meal per day and incorporate more plant-based protein sources. You are not broken. Your information has simply been incomplete, and starting right now, that changes. If this video helped you, smash that like button. Subscribe to this channel for more real health solutions built specifically for adults over 50 who want to protect their kidney health, their heart health, and their independence for decades to come. And share this with someone you care about, a friend, a family member, a spouse. You may just give them the piece of information that changes everything. And I want to hear from you. Which of these 5 causes surprised you most? Which one made you think, "That might be me"? Share your answer in the comments below. I truly want to know your story. Because remember, your kidneys have an extraordinary ability to recover if you catch damage early and remove the source of harm. But that recovery depends entirely on knowing what is harming them in the first place. Now you know. And knowledge applied becomes protection. Take care of yourself.